Good morning, everyone. For those who are waiting, we'll begin in about 4 or 5 minutes. Hello, and welcome to the 12th Annual Dallas Hunger Summit, Demystifying SNAP and Changing the Conversation. Thank you all for attending. My name is Elena Pierre, and I'm the Director of SNAP and Social Services Assistance for the North Texas Food Bank. I'm also a member of the leadership team of the Dallas Coalition for Hunger Solutions. The Dallas Coalition for Hunger Solutions was established in 2012 and, guided by a leadership team, has brought together over 300 organizations and individuals to develop ideas and implement strategies to reduce food insecurity and promote food equity. The mission of the coalition is to work collaboratively with the community across sectors to identify challenges and solutions towards achieving equitable access to healthy and nutritious food. Our strategic goals include increasing the participation of eligible populations in federal and state nutrition programs and promoting strong federal, state, and local policies to remove barriers and hurdles for participating in these programs. Today, we're going to examine the Supplemental Nutrition Assistance Program, commonly known as SNAP, and how it helps provide support for many of our neighbors struggling with having enough nutritious food. We know that nutritious food access and having a nutritious diet help keep us healthy, and a lack of access and a poor diet can lead to disease and health disparities. SNAP is an underutilized tool that can help improve health and reduce health disparities by supplementing household food budgets for many eligible community members. Today's conversation is intended to dispel myths, provide new language, and encourage partnerships and opportunities to present SNAP positively. It is our hope that today you will gain knowledge to take into your communities to help change the way SNAP is viewed, be able to talk about SNAP in an informed way, advocate and educate for SNAP, and help others better understand the pivotal role SNAP can play in reducing food insecurity and hunger and maintaining good health. We are recording today's webinar, and everyone will receive a link to the recording and the slides in a follow-up email in the next few weeks. We would like to thank our partner, the American Heart Association, for providing the technology for today's event. And now it's time to introduce our first topic, SNAP 101, and our keynote speaker, Jamie Olson. As the Director of Policy and Advocacy at Feeding Texas, Jamie focuses on federal and state policies around food, nutrition, and economic development. With a diverse background in both the nonprofit and public sectors, Jamie holds a master's degree from the University of Texas at Austin and a Bachelor's of Arts from the Temple University. Without further delay, I'll turn over the virtual floor to Jamie Olson to guide us through SNAP 101.
Thanks so much, Elena, and I'm just so happy and honored to be here with you all today. We are definitely going to start with a little SNAP 101, but first, next slide. I just wanted to say I'm Jamie Olson, Director of Policy and Advocacy with Feeding Texas. We lead a unified effort for a hunger-free Texas, and we are the State Association of Food Banks. So we've got 21 food banks that collectively cover all 254 counties in the state. But we do a lot more than provide food. We also advocate for systemic solutions to end hunger. We provide SNAP application assistance, nutrition education classes, and obviously activate in times of crisis. Next slide. I'm also the co-chair of something called the Texas Food Policy Roundtable. This is a coalition of over 60 organizations that's dedicated to improving policies to address hunger and creating an equitable, sustainable, and accessible food system for all Texans. Next slide. All right, let's dive into SNAP. As we know, SNAP is a critically important tool for addressing hunger, but why is it needed, right? So Texas has one of the highest rates of hunger in the nation. 13.7% of Texans of all ages are food insecure, and roughly 3.6 million people rely on SNAP in the state. But we know that benefits are too low, and that SNAP truly is a supplement for household food budgets, because the average SNAP benefit per person per meal is only $1.97. So that's one key area for advocacy. We can talk a little bit more about that later, but SNAP benefits, they typically run out between the second and third week of each month when a family receives those benefits, because we know that it is not SNAP does not make up the entire household food budget. Next slide. So what is SNAP? SNAP's the largest and most effective anti-hunger program in the United States. There are also many other programs focused on alleviating hunger. Some of those include the National School Lunch Program, the Summer Food Service Program, the TFAP program, CSFP, which is a senior box program. There are many others, but SNAP is by far the largest and most efficient and effective. It helps families by providing an EBT card, which you can think of as a debit card that folks are able to use at retail stores and farmers markets and other food outlets to purchase food. And that's why SNAP is so efficient, because we are leveraging the retail grocery infrastructure that all folks in America use, not just SNAP clients. So instead of setting up a separate method of providing food to low-income folks, we're just asking them to go to the grocery store like everybody else. And so we're really leveraging the investment that private sector makes, and SNAP is also a critical source of income. It keeps for those retail stores, it keeps a lot of retailers going, especially in rural communities. So SNAP's a big economic driver as well. And a fun fact is that rural areas often participate in SNAP even more than urban residents do. Next slide. And this is just to give you a kind of scale of magnitude, because I think oftentimes when we think about low-income people and hunger and providing food, we think of our food banks, and our food banks do an amazing job providing meals to their communities. But for every one meal that a food bank in America provides to a family, SNAP provides 9. So again, when we're just thinking about the magnitude of the program, and when we think about potential policy changes that either increase access to SNAP or make it harder for families to access SNAP, those have direct impacts on the charitable food system, right? So if we make cuts to SNAP at the congressional level, if we tighten restrictions so that not as many folks are able to receive SNAP, we see that impact in our food lines, right? Our demand at our food banks often increases as a direct result of the tightening of those policies around SNAP. So SNAP and food banks go hand in hand, and it's just critically important that we keep SNAP strong, because food banks are not able to make up for any cuts to the program. Next slide. Back on that economic benefit of SNAP, USDA estimates that for every $1 that's distributed to a SNAP recipient, that generates between $1.50 and $1.80 in economic activity. So it puts money, like I said, in the pockets of farmers, manufacturers, food retailers, everyone along that chain of farm to fork. And so according to SNAP to Health, every $1 billion of SNAP creates between roughly 9,000 and 18,000 full-time jobs, right? So SNAP is a job creator, it's an economic activity generator. It really helps keep our local food system strong. So there's all these ancillary benefits besides just feeding hungry people. Next slide. Yep. So I wanted to highlight a couple policy victories that we had in this past 88th session, the legislative session here in Texas. So this is state legislation. And one of the issues we focused on was the vehicle asset limit. The vehicle asset test or vehicle asset limit is exactly that. It's a limit on the value of a person's vehicle that they can own and still qualify for SNAP. And many states, I think roughly around 42 states, have completely done away with vehicle asset limits. They just simply, do not look at the value of people's vehicles when they apply for SNAP. They don't, and we don't do that for other programs like Medicaid. There's no vehicle asset limit in that program, but in SNAP in Texas, there is one. We did try to fully eliminate the policy for several sessions, and there was not an appetite for that at the Texas legislature. So we pushed very hard to update the limit. And earlier this year, we passed HB 1287, which will adjust the limits upwards. The previous limit was $15,000 for a family's first car. That limit's moving to $22,500. And then for all other cars, so SNAP is a household benefit. So if a family owns more than one vehicle, the limit for additional vehicles is $4,650. That was the old limit. And now that's moving to $8,700. So this is a huge win, even though we didn't get to fully eliminate this policy, which would have been the kind of gold standard. Just updating these limits that were very outdated. They had not been updated since 2001. This will help thousands of families get connected to SNAP that previously were not eligible due to this policy. Oh, and this just shows the need of updating those limits. So these are denials, the number of applications that were denied due to the vehicle asset limit. And it shows the number of denials for, you can see in years 2017, sorry, the print is kind of small, but those first three bars are 17, 18, 19. You see it's holding pretty steady around, 13,000 or so. FY 2020 shot up, and that's because of the pandemic, right? So more people applying means more people ultimately subject to this policy and denied. So when it jumped up from roughly 13,000 to 27,000, that's not surprising because so many more people were applying for SNAP. But then what is really surprising is we saw in 2021 and 2022, those numbers just continue to climb. And that's not due to the pandemic and more people applying, because in those years, the number of total applications actually kind of decreased from 2020. And so what that is due to is inflation in the used car market. And we saw a lot of people actually getting denied at recertification, which means they applied for SNAP, they were approved, they were receiving benefits, and then the value of their car increased so much that they were then kicked off the program and lost those benefits due to no fault of their own. They didn't go out and buy a new car, right? The same car that we're talking about, but the value of that car increased so much that they lost their SNAP benefits. And that's a really tragic story for any family to have to go through. I talked to many individuals that experienced this, and it was heartbreaking every time. And so fortunately, we were able to get the legislature to update those limits. And then another bill that we passed this time, this was our first session working on this legislation. So I'm so happy that the legislature saw value in it and that it passed this session. We created a bill that's going to allow Texans that are reentering society after being incarcerated to apply for SNAP prior to their release. So the current process is you have to wait till you're released and then apply, and then wait, under normal circumstances, 30 days. Right now, due to delays at HHSC, they could be waiting even, several months before receiving their benefits. And so this will allow folks to complete the paper application and the interview process and all of the just administrative things that need to happen while they're still incarcerated, and then receive benefits upon release. So they actually get their card mailed to the facility that they're being released from, and it'll be in their release packet. So when they literally, sort of walk out the door, they have that with them, and food doesn't have to be a barrier to their reentry, because obviously they have so many other things to focus on: housing and finding a job and reconnecting with their family and all the things that they're, excited to do, but that can be challenging. We don't want people to be going hungry while they're trying to do all of those important things. Next slide. Yep. And now we're going to talk about the Farm Bill. So the Farm Bill is a very important piece of legislation, and this is at the congressional level. This is at the federal level. So the other two bills that I just spoke about, that was Texas state legislature. This is Congress. The Farm Bill is a major piece of food and farm legislation. It covers a wide variety of topics. You can see them kind of listed at the bottom there. Everything from farm commodity supports, conservation programs, crop insurance, but we care about is nutrition assistance, is included in the Farm Bill. And so the Farm Bill roughly gets reauthorized every 5 or so years. This Farm Bill actually is already expired. Sorry, there's a mistake on this slide. The Farm Bill expired September 30th. They have not passed a continuing resolution. That was on the budget slide, so please ignore that. The Farm Bill expired September 30th, and that does not have impacts for the nutrition programs. So SNAP and TFAP and those sort of programs are continuing, as is. But it does impact certain agricultural programs and other things. So we're going to need to encourage Congress to reauthorize a Farm Bill soon. I think I'm getting ahead of myself in the slides. Can we go next? I think I have a timeline slide. Oh, on the nutrition. Yeah, go back. Sorry. On the nutrition assistance, this is just a snapshot of what all is included. So there's TFAP, the Emergency Food Assistance Program, the Commodity Supplemental Food Program, that's that senior box program I mentioned. SNAP is the big one, including nutrition education, employment and training, SNAP outreach, SNAP benefit levels and enrollment policies, and then also a program specifically for Indian reservations called FDIPR. All the acronyms. Now let's go to the timeline slide. So there's a lot happening, both on the Farm Bill and on the funding side of Congress. They did pass a continuing resolution to mid-November on the budget. However, the Farm Bill did expire on September 30th. So now we're in this sort of holding pattern. They also need to elect a new Speaker of the House, and nothing can happen until they do that. So we're waiting for a new Speaker to be elected in the House. And then the first priority is going to be funding the government. They have until November 17th to either pass a full funding bill or another continuing resolution that might just kick the can down the road a little bit. And while Congress is focused on funding the government, that delays a Farm Bill. And so at this point, December 31st is sort of the new target for having a Farm Bill. But there's a less and less chance of it happening by the end of the year as time goes on. And so if no Farm Bill is passed, no new Farm Bill is passed, or the current Farm Bill is not extended by early January, then we start to see some really drastic things happen on the farm side. Crop insurance and other agricultural subsidies will expire. And so there's going to be a lot of pressure on Congress to pass something by the end of the year. Either, like I said, a new farm bill in its entirety, or a continuation of the current farm bill. And if they do pass a continuation, that pushes us into 2024. But then we have to start thinking about the election season that will come up, and election politics kind of come into play. So we have not yet even seen a full draft of the Farm Bill, either from the Senate or the House. What we have seen is many marker bills be filed. A marker bill is something that a member will file to sort of state their position. Like they would like to see, you know, this specific policy change happen. And it's not a bill that they hope to pass on their own. It's more of a policy proposal that's introduced that can be used as a starting point for debate and potentially get included into the larger Farm Bill package. So there's many marker bills out there right now. It'd take me a long time to describe them all, so I'm not going to do that. But what we need to see is those chambers, both the House and the Senate, start drafting their bills so that then negotiations can begin. And we're looking, like I said, at either very late 2023 or early 2024 for the timeline of when this might happen. Next slide. I wanted to spend a minute and talk about messaging, because messaging can be so important. And there's a lot of fun facts that people may not know buried in this slide. And so I'm not going to read all of these, but these are messages that we have heard, you know, really resonate with certain groups. For example, children, older adults, and people with disabilities represent 90% of households who get SNAP. So when we hear Congress talk a lot about work requirements and able-bodied adults and people needing to get back to work, just know that they're talking about a relatively small portion of the people who are actually on SNAP. Most of the people on SNAP are not considered people who we would consider needing to work, right? They're elderly, children, or people with disabilities. I kind of talked about benefits adequacy on that first slide, but on average, participants only receive about $5.45 per person per day. Again, I don't know, you know, with food inflation, how it is these days. I don't know how much you can buy with $5.45. It's certainly not enough for 3 meals a day. So benefit adequacy is another major thing that we talk to our members about. And then some you know, on the more right side of the spectrum, there's been a lot of talk about abuse and fraud in the program. And we want folks to know that as far as government programs go, SNAP actually has a very small amount of abuse. It's actually one of the tightest government programs that there is. And this is thanks to technology and data matching that enables states to verify income and other applicant data. So we should continue to invest in these technology solutions. All right, so who are our Farm Bill targets? We have 5 people in Texas who are very, very important to the process. That's not to say every member doesn't count. Every member counts because every member will ultimately vote on the Farm Bill. But the 5 that are very important are listed here for you. The top 4 are members of the House Agriculture Committee. So that's Greg Casar from the Austin region, Monica De La Cruz from the Valley, Jasmine Crockett from the DFW area, you know, go Dallas, right? And then Ronnie Jackson up from the Panhandle. And And then the other one is Senator John Cornyn, who of course represents all of us as one of our 2 state senators. And he's very important because he's a member of leadership in the Senate. And so when he takes a position on something, other people kind of take note and follow suit. So these are the folks who we've been talking to quite a bit over the past year or so as they've been working on the Farm Bill. So if you want to act, I wanted to just, highlight some things that you can do that hopefully are easy and accessible. And if you have questions, you can be sure to reach out to me. But I'll definitely calling Senator Cornyn's office. One of those really good marker bills that I mentioned is called the Farmers Feeding America Act, which would double USDA support for your local food bank. That's through the TFAP program, which I know I didn't spend a whole lot of time talking about today, but that is something that Senator Cornyn could do that would be super meaningful. And that's his office number right there that you could call and talk to his staff about that. You can speak with your board members, supporters, and local elected officials about the importance of the Farm Bill and the importance of SNAP and keeping a Farm Bill, keeping SNAP whole and not making any additional cuts to the program in the Farm Bill. And you can also bring, local news media and community partners together to talk about programs like SNAP and the difference that it makes for the neighbors that you serve. And there's my contact information. So I know I only have a couple minutes left, and I've seen the chat kind of blowing up. So I don't know if Wyanella or Jenny or if Alana, if there's specific questions you would like me to answer.
So this is Wyanella. Yeah, and I've made some notes here of the questions. So Jamie, in the time that we have left, I'm going to ask as many as we can cover. Do you see any political momentum to remove the vehicle asset test entirely? Is this a policy in most states?
Yeah, so unfortunately, no. I don't see any political momentum here in Texas to remove it in our state. We have talked to some federal legislators about potentially removing it as a policy option because it's a state option. States have the option to choose whether or not to have a vehicle asset test in their SNAP program. And in Texas, we tried that for 2 sessions in a row. So that's 4 years of trying to make that happen. And then we ultimately compromised with our Texas legislature on just increasing the limits. So I don't think there's political will here in Texas to make that happen. At the federal level, most states don't have vehicle asset tests. So it's kind of also tricky there because many congressional members aren't going to be concerned about the policy because in their state it doesn't exist. And so it is challenging to sort of lift it up at that level as well. But we're going to keep plugging away. So never fear.
Thank you, Jamie. So anything about college students living on campus, does this affect family benefits? That's the best I can do to frame that.
Yeah. So college students are a special focus for us as well. And the SNAP rules are particularly complicated when it comes to which type of students are eligible. There are different rules for if you're they call it more than half time. So if you're like more than half time up to full-time student versus less than half-time student, different rules apply. And it can be very, very complicated and difficult for students to navigate that process. So that's one big issue, simplifying the policy, which would have to happen at the federal level. And then educating students about their eligibility and that they, should apply for the program. In terms of how it affects the family back home, SNAP is a household benefit. So if that college student is still living at home with their family, then it would impact, for example, like if that college student was ineligible for SNAP and they're living at home, only that one person's benefits would be essentially removed from that household. So instead of having a household of 5, if one of them becomes a college student, you now have like a household of 4, if that makes sense. If the student is living alone or, either on or off campus, right, then they're applying as their own individual household and not with their family unit that would be, living back at home. I hope that makes sense.
Yes, thank you. That helps. Does Texas allow for individuals to apply for SNAP benefits while still incarcerated?
So you cannot receive benefits while you're incarcerated. That is a federal rule. And that makes sense, right? Because while incarcerated, your meals should be provided to you by, the facility in which you're incarcerated. So you cannot receive SNAP benefits while you're incarcerated. The change that we made with that state legislation is now it says when a inmate is assigned a release date, so they know, okay, my release date is 2 months from now, then they may go ahead and just do the paperwork. So they can fill out the entire application. They can even conduct the interview because there's an interview requirement for SNAP. So they can get that interview done, and the state can go ahead and process that application while they're still incarcerated. They don't receive the benefits though until they're actually released. So the card would be in their release packet, and they would the benefits would be activated the day after their release date. So I hope that makes sense. Yeah.
Yes, yes. And which is something that makes perfect sense because, as you say, there are a lot of challenges upon leaving incarceration and returning to the community, and being able to eat shouldn't be one of them.
Yes.
Okay. What percentage, I don't know if you know this information or not, but there's another question. What percentage of SNAP participants work?
Yeah. So like I mentioned, most SNAP participants, if we're looking at the whole total enrollment, they're folks that we don't expect to work, right? So children, elderly individuals, people with disabilities, right? Those folks are not subject to the work requirement. They're not expected to be working. Of the population that we do subject to work requirements, because there are work requirements to receive SNAP. If you are what's called an able-bodied adult, you have to register for work. You have to be either working a certain number of hours or in an employment and training program. So there are work requirements, very strict work requirements already in the program. And if you're not complying with those work requirements, you can actually have your benefits taken away from you. So I like to say, like, of the total SNAP population, those who can work, they do work. They are working. And I don't have specific percentages to give you, but that's the general answer.
Okay, thank you. So we have someone with us from Israel.
Oh,
and yeah, and he's joined us before. Actually, I recognize his name, Shmuel. And so he's got his question in the Q&A. I think there might be something, I might lose something in interpreting what he's saying here, but what, according to the role of state and municipal authorities in effective realization of SNAP? I think what do you think is
Yeah.
the role of state and municipal authorities in effectively realizing SNAP? That's part of it. And then some recommending to countries like Africa, Asia, and Latin America the implementation of SNAP.
Of SNAP. Yeah. Okay.
Yeah.
So yeah, that's a meaty question. I'll try to answer very succinctly. SNAP is a federal program. So most rules about who is eligible and what the benefit level is, like how much, people actually receive, most of those things are set at the federal level. States then do have some kind of policy levers that they can pull to either expand access to the program or tighten up access to the program. And the vehicle asset test is a good example of that. We pull that lever here in Texas, and it unfortunately, reduces the number of people who are eligible in our state. At the municipal level, there's not a whole lot. I'm trying to think if there's any. There's not any effect that municipalities can have on SNAP policy, but what cities and counties, what they can do is focus on SNAP outreach, education, and having resources available for people like to help them apply for the program. So like our local food banks or other community partners that can assist people with the application. That's where cities and counties can affect change. It's just that outreach and education piece. As far as recommending that other countries follow the model, I've never been asked that question before, but I just go back to the fact that we have many anti-hunger programs in this country, and SNAP is by far the most efficient and effective tool in our toolbox. So as far as recommending it to other countries, I think the crux of the issue is that SNAP depends on there being a retail infrastructure to rely on, grocery stores or farmers markets, corner stores where the benefits can be received. So, where the benefits can be spent. So as long as whatever other country we're considering has a similar like retail grocery infrastructure, I think it is a good model for hunger relief.
And I think we have time for one more question. This one is about women women transitioning out of domestic violence who might be living in shelters, temporary housing. Issues with getting SNAP because of bank account information with previous spouse. Is that anything you're familiar with as a barrier? Anything to say about that?
Yeah, that can be a very challenging situation for folks, and I certainly feel for them. I think those cases are so like specialized and unique that I would just say if you come across a person in that situation, reach out to a community partner, reach out to your local food bank or other SNAP assistance case navigator, and they can help that person navigate that process and try to find workarounds. So that is a complicated question, but certainly a problem for some that we need to address.
And you might be able to answer this one quickly. What is the age requirement for the able-bodied workers?
Able-bodied adults, yeah. So it used to be 49 was the age at which we stopped requiring people to be subject to the time limit. It's 59 for work registrants, but the SNAP time limit, which means if you're not working 20 hours per week, you can be kicked off the program after 3 months. Congress recently raised that. So it was 49 and they've raised it to 54. And we're currently in a phased implementation of that. So they've just added 50 and 51-year-olds this year to that able-bodied adult without dependent time limit. And then they're going to be adding 50, 52, 53, and 54-year-olds soon. So.
Well, thank you. I think that's all that we can manage. Jenny, I'm turning it back over to you. Thank you, Jamie.
Thank you, Jamie. I appreciate it sincerely, and grateful to have your wisdom on this on our summit today. We're grateful for you, and I would ask to everyone, if you are still having a question, feel free to keep it in that chat. We'll be able to send them out to Jamie. We're going to work to get everybody's questions answered, and just appreciate that participation within the panel. So thank you all very, very much. And thank you again, Jamie. I am Jenny Iyer. I am the Vice President for Health Strategies at the American Heart Association and a member of the Coalition's leadership team. I'm grateful for everyone joining us today. We've got a large group here, and just grateful for everyone participating and being involved. It is my distinct privilege to introduce and moderate our community panel, who is going to discuss expanding SNAP access and maximizing SNAP utilization. We're thrilled because this is going to be very specific to the North Texas community, and being able to take and show what Jamie was just talking about, show how it's being implemented right here. So just grateful for the panelists joining us today. I invite each of you in this virtual audience to write any questions, again, that come to you during the panel presentation in the chat box. We are going to answer as many questions as the time allows. But if we're unable to get it to you, just a reminder again, we will make sure to follow up with answers following this summit. Our panelists represent a small cross-section of community leaders trying new ways to expand access to SNAP and make it more impactful for our eligible neighbors. I'm excited to welcome these panelists to our virtual stage today. Tarian Alexander is a faith community health worker for the Baylor Scott and White Health and Wellness Center, which is a partnership with the Juanita J. Kraft Recreation Center in Dallas. She's also a nursing student about to complete her studies at the University of Texas at Arlington. Dr. Donald E. Wesson is a professor of medicine at the University of Texas Dell Medical School, a nephrologist, and an internationally recognized kidney researcher. He's a longtime advocate for improving the health of communities through focused, data-driven population initiatives. Dr. Wesson is representing South Point Market as well today, and the SNAP incentive program offered by the market to the community. And our final panelist is Leda Valdez, who's a social services field manager for the North Texas Food Bank. She has helped develop and now implement the Food Bank's SNAP mobile project. She's going to be able to share a lot of the great work that the Food Bank is doing around SNAP across North Texas. All righty, panelists, I'm going to welcome you to this stage. Hopefully everyone can see them bright and big on your screen. And I'm going to ask you each, I held off. You're all doing some really wonderful and amazing things. I held off on the intro because I wanted you to get to speak a little bit about yourself. So just want to let you all take a little bit of time, because Jamie gave a phenomenal overview of SNAP. And now each of you are going to take that and share how SNAP is being promoted, accessed, and utilized across North Texas. So I'd love for each of you to take a few minutes to introduce yourself, add a little bit of detail and flair to what I just shared, and give a brief overview of how you and your role utilize SNAP on a regular basis. Leda, I will start with you. I'll go to Tarian and then Dr. Wesson.
Can you hear me?
We can.
Okay, perfect. So as Jenny said, my name is Leda Valdez, and I've worked at the North Texas Food Bank for the last 5.5 years in our social services assistance department. So we're actually part of the Texas Community Partner Program. So we help neighbors apply for and manage their SNAP benefits, along with Medicaid, TANF, Healthy Texas Women's, Medicare Savings Program. As navigators, we educate our neighbors on how to use the SNAP benefits, how they work, how to apply, what the next steps look like, submitting process-ready applications, and really identifying and resolving issues that can pop up during the application process. So our overall goal is really to educate and promote accessibility to help individuals become self-sufficient. So we are that face for the North Texas Food Bank that goes out into the community to assist those individuals on a daily basis. And we do have several, I'll take up two. We do have several different ways that we outreach. I'll just touch on them real quickly. We have navigators that go out into the field. We have a call center, our SNAP Mobile, which focuses on rural efforts. And we do have a few other opportunities that we utilize to make sure we reach as much of our counties as possible.
Thank you, Leda. I know we'll get to hear a little bit more about some of those in just a second. Carrie Ann, would you take a second?
Yes, good morning. Can you all hear me? Good. My name is Terry Alexander, and I am a community health worker for Baylor Scott and White Health and Wellness Center at the Juanita Craft Recreation Center here in Dallas. And the purpose of our program is to educate and bring in health and wellness programs to our community members. I have the opportunity to partner with our faith community, and that is one of the places that we meet up with the community members to offer programs that will help assist clients with diabetes management. We offer programs to help you get more active, become more active in your life, daily life, with group lifestyle balance exercise programs. We offer nutrition classes that will help you kind of take control of your overall health and wellness. And the purpose of our programs is to help our community members take control of their health and become more healthy on a daily basis. The focus of many of our programs with the faith community is to empower our members. And we offer farm stand locations at a number of places. We have a number of locations. And how do we assist with SNAP? Well, the programs provide fresh fruits, vegetables, or healthy items that members of the community can purchase with their SNAP benefits. So our programs are designed for them to be utilized with SNAP as well as other means of payment. And the goal is to teach you what to eat healthy, how to prepare it, and then how to continue the cycle. And if you live in a place that's a food desert, you have a place that you can come to that's within walking distance or within your local area where you can come in and purchase the necessary food items that you want to eat that will create or help you continue wellness programs or help you continue to be healthy overall.
Thank you, Terry, and appreciate that. Hard to eat healthy if the food is out of reach, affordability wise. So grateful that you're able to pair those pieces with the SNAP access. Dr. Weston, over to you.
Thanks, Jenny. And first of all, let me say it's a real honor to be a part of the panel and to be a part of this overall initiative. And a shout out of thanks to Janie Olson. I really appreciated her overview of the SNAP program. So I'm a member of the Cornerstone Baptist Church community that does a lot of outreach to help the surrounding community. I'm also a physician researcher in my later years have focused on the benefit of nutrition, particularly fruits and vegetables, on kidney and cardiovascular health. One of the things that I'd like to emphasize that Jamie said in her presentation is that SNAP recipients have to have a retail infrastructure through which to spend their benefits. And in the Cornerstone community, which is a food desert, there had not been such a facility. And I'm proud to say that my son led efforts to start the South Point market there that will provide fresh produce and other healthy food items for the community. So that is one way by which the South Point market is supporting SNAP, and such that SNAP recipients in that area have a place easily accessible within walking distance for most of our residents, not just church members, but those who inhabit the surrounding community, to use their SNAP benefits there. And so that is a way by which to incentivize individuals to get more uh, 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 to register for SNAP and to get SNAP benefits. Of course, the incentive program that we're going to talk more about that will reduce the cost. They can get fruits and vegetables for 50% off, and so that's encouraging individuals to eat those healthy food items, and in that way is promoting health. And you've heard Tarian talk about this great program, Group Lifestyle Balance, that teaches individuals how to eat healthy. And my wife, Wanda, oversees that at our church at Cornerstone Baptist Church. And then lastly, I'll say that we use the SNAP program to help out our entrepreneurs. We have small business entrepreneurs in the Cornerstone community that part of their business is making and selling healthy food items. And so the South Point market has been a place by which they can bring those healthy food items. SNAP residents can purchase them there. And so the SNAP residents are being helped by getting healthy food items, and those entrepreneurs are helped by having their business supported by those SNAP dollars.
That's perfect. Thank you, Dr. Wesson. I love how I did not plan it that way, but inadvertently kind of took you down the path of the SNAP system for someone who might be a participant in SNAP, right? You're applying for it. You're being educated on why you need access to healthy food to help your diet with diabetes or hypertension diagnosis, and then where you can actually utilize your SNAP dollars. Does not help you at all if you are a SNAP participant, but you don't actually have a place to utilize that program. And so just grateful for each of you being here and sharing how you are a part of a person's journey through SNAP. Leda, since you are the beginning for many, many people, I'm going to go back to you. I would love, as the first entry point for many into SNAP, could you share about some of the innovative opportunities that the North Texas Food Bank has provided, is continuing to provide, where you've been on the forefront of this, to improve upon the SNAP application process and remove barriers for many in our community?
Yeah, of course. So one thing about us is we are constantly changing and adapting to really meet the needs of the community that we serve. We have several different efforts and opportunities to help with the application process. So just to kind of touch on each one of those. We have navigators that do provide direct application assistance out in the community. So we meet the people where they come to receive that food assistance. That could be at a food pantry, a homeless shelter, any other location where people come together. We also have a call center for anyone that is unable to go to those places or doesn't have any transportation available. So they can actually call our call center to receive that assistance over the phone. We have a SNAP Mobile. This is a new program that we started. It's actually a office on wheels, and that specifically focuses on our rural counties where we may not have an agency that has the space or the resources to house us to even provide those services for their community. So we provide the space and the resources that are needed during those times. So that is a great program. We also have a QR code that we can provide organizations or individuals to really simplify the application process. as well as community specialists. We have an individual who goes out and she serves isolated communities, which can include seniors, anyone in reentry, rural communities, just any of those spotty areas that we may have missed or have to have some more specialized attention.
That's wonderful. Thank you, Leda. I think we're in a little bit going to ask for a few more details on how people might get to you and asking how they might be able to utilize some of this. But how have you seen some of those strategies break down the barriers that people have had? You know, I know we talked to a lot of people and a lot of out in the community who say, well, I need a SNAP navigator, you know, someone here in person, but you've actually made it so that it makes it easier so that people don't actually have to be face to face to start the process. There's a lot of different ways that individuals can access a SNAP application and get assistance while doing so without having to drive somewhere necessarily, you know, during their limited time or limited availability.
Yeah, so and I will highlight two of our most impactful strategies that we have at the food bank. I'll go more into detail for our call center. So we actually have a full team of 8 navigators that are ready to assist daily, because again, a lot of people that are in the situation that need those benefits don't have access to transportation, may not be able to get to those sites to even receive food assistance. So they can actually call our call center. Their hours are from 9 a.m. to 4:30. And even if you call outside of those hours, we have a lot of people that work full time. You can actually leave a voicemail and a navigator will reach back out to them as soon as it'll be the following business day, depending on what hour they called, but they'll receive that immediate assistance. And anyone can really call our call center to ask questions, even if they really don't know what SNAP is. You can call in to ask questions about the benefits, how to apply. We have people that have already applied and really don't know what the next steps look like. So just any general questions about SNAP, they can also call in to receive full application assistance. So they don't have to struggle through the application process. For those of you that have never seen it, it can be a long and tedious application, and it can be difficult to answer some of those questions depending on the household situation. So we provide the full application assistance, or we can even set them up for an appointment at a later time. We have many individuals that call during their lunch breaks and they may not be off till 3 p.m. that day. So we can set them up with an appointment, and any application assistance can be done over the phone, virtually on Zoom. We use FaceTime as well for people who have iPhones and Apple products. We really try to make it work for any individual. So if they really can't do the virtual thing, we can just go ahead and do it over the phone. But we really try and do the best process that we can for them. Or even if they don't want to call in or they don't have any SNAP related questions, they can also call our call center to find additional resources for other food sources like food pantries. We have a lot of people that ask for food pantries that deliver because they, again, don't have that transportation, or any organizations that provide rental assistance, utility assistance. So there's a large number of resources that they can call in to ask about. So it's a wonderful resource. Our second most impactful program, I'll say, has to be the QR codes. So we do have a lot of organizations that have a lot of need within their community, but they may not need one of our navigators on site full time, but the need is there. So with our QR code, we actually have a new form that we created. So it really simplifies the application process. And what it is individual can just scan the QR code. They'll answer some basic questions to get the application process started. Once they submit it, that actually goes directly to our call center. So they'll have a navigator follow up with them to provide the full comprehensive application assistance. So we make sure that they get fully educated on what that process will look like, how long it takes, and if they're missing any documents. It's very easy. It's very mobile friendly. A lot of people have smartphones. It's very rare that people don't have smartphones nowadays. So it's just a very simple process to utilize. And the way that we work with some agencies is they may have a volunteer or an individual on site that really works with those communities one-on-one. So they have that trust built up with them already. So we teach them how to utilize that form online. So if they want to sit down with that individual at the food pantry or the church, whatever the location may be, they can just pull it up on a computer, pull it up on a smartphone, and help them walk through that process. And if you take a look at it, it can take less than 5 minutes to get that process started. And then we do all the heavy work on the back end once we reach out to those individuals.
That's so exciting. Like I have seen the QR code firsthand. I know Dr. Wesson has as well. And it's just phenomenal how it's been simplified. So we're incredibly grateful for all the work the food bank is doing to decrease those barriers. It's just phenomenal. I know that many of you might have more questions on how you connect and learn about this. I see Elena's working in the chat. So if you have questions, Elena's got some contact information for you that she's put in the chat, and we'll continue to keep talking about it later on, but wanted to highlight that. Thank you, ladies, so very much. Tarian, you are taking, once people are learning about SNAP or want to know more about it, you're talking about healthy eating, getting up and moving, and how you might take those next steps after a diabetes or a high blood pressure diagnosis. You're really on that health side, but you're working face to face with so many congregations all across our area. How, for someone who might be learning a little bit about, wow, SNAP, I could use this right now where I am. Could you share about what you're doing right now to help support SNAP where you are in a congregation, and how you're doing this work to not only advance health and wellness, but also speak to how SNAP plays a role in those conversations that you're having daily?
Sure. Normally with many of our congregations and our community members, we have an opportunity to become one-on-one or, kind of intimate with each individual. So we have an opportunity to kind of sit down with individuals and kind of see what their situation is. And based on what their current situation is, we try to become a referral source for them. And what I mean by that, in a situation with SNAP, what we go in to do is to teach you how to eat healthy, how to cook healthier, how to produce in your household ways to improve your health overall. So with the SNAP benefit process, now a few of us are former navigators with the SNAP process, which means we can go through the process with you, help assist you with filling out those forms. Now we don't do that as much anymore, but what we do is try to refer our community members to people that can help them to get certified for SNAP, find out what the benefits are, and find out if they actually qualify. Because a lot of times, many people are not aware that they even qualify for the benefits or know how to access those benefits. So we are kind of like that middle person to help give direction so that they can come in and figure out if they do qualify, and then go to the places where they can get those applications completed. Now, once they do become benefactors of the SNAP program, we have different locations all over our community to help you use your SNAP benefits. Meaning, in the faith community, we have a number of churches that have partnered with Baylor Scott and White, so that when you come in, there's a farm stand there, so you can purchase those fresh fruits and vegetables. For instance, Cornerstone Baptist Church is one, of course, that Dr. Wesson talked about. We have Oak Gardens Church is another one. We have quite a few. Then also the Recreation Center here at our location here at Juanita Craft Center, we have a farm stand. So we have about 8 to 10 locations that SNAP benefits can be used in. The goal is to give you the information, teach you how to eat better, and then how to assess that with what you have available to you. Does that answer your question?
It does. I appreciate it. It's perfect. And you're doing the moderating for me, Terry, and you're passing it right off to Dr. Wesson to kind of bring in his piece. But I want to touch again on how important that access point is that you mentioned, right? It does not help you if you have if you are on SNAP and receiving SNAP benefits if you don't have a place to actually utilize them. And so thank you for highlighting the different locations that you all are working on to bring the healthy and nutritious foods to community members so that they can utilize those SNAP dollars and purchase them. I appreciate that, Tarian, very, very much. Dr. Wesson, you have a very unique perspective as being a physician and knowing how important access to healthy foods is to overall health and well-being, but also working on a daily basis on bringing that improving access points. So when we talk about SNAP is more than just access to food. Can you share how South Point Market is leveraging SNAP and your SNAP incentive program that you mentioned to benefit the community as a whole?
Sure. So thanks, Jenny, for that great question. So in answering that question, let me begin with something very important that Jamie Olson said that I like to emphasize, that SNAP is an investment. It is literally an investment in our communities. And so when these individuals now have a community-based retail infrastructure, in this case, South Point Market, they can now spend those SNAP dollars at this community-based facility. That helps the facility for sure, and it helps the community overall. One of the statements that I saw in the chat is that a great many SNAP recipients spend their benefits at convenience stores. We would rather have them spend those at stores where they can get very healthy food items, the type of food items that Tarian mentioned that help support health. And as I mentioned, I mean, not only as a physician, but as a researcher, I spent my career studying how nutrition helps to support and specifically kidney health and cardiovascular health. And Tarian mentioned that great program, the Group Lifestyle Balance, that teaches individuals how to find, prepare, and eat healthy food items that again, overall promotes health of that individual, of that family, and eventually of the community. And so the SNAP benefits, particularly with the incentive program, where the SNAP recipients get an opportunity to have 50% of the cost of fruits and vegetables covered for them. Fruits and vegetables is a very important part of the group lifestyle balance food that is provided for individuals to promote their health. And in that way, SNAP is promoting the well-being of the community through promoting the group lifestyle balance program. And the last thing that I'll add, what I alluded to before, it's also supporting entrepreneurship in the community, because we now have small businesses where individuals are preparing healthy food items as part of their business. They bring those items to South Point Market, and now the South Point Market and those entrepreneurs are able to benefit from the sale of those healthy food items to individuals in our community. So I go back to what Jamie said. It is an investment in our community, and it's an investment in the health of our community as well as the economic health of our community.
Yes, I completely agree. And I love, Jamie said, from farm to fork. I love that image, right? Where SNAP is helping the farmers who are growing the foods and the produce, helping retailers who are selling it, and then helping the participants who have better access to fresh fruits, vegetables, healthy canned, healthy frozen fruits and vegetables that they would not have otherwise been able to have access to. So it's really helping that entire trajectory from farm to fork. And I love that. And
And it's getting rid of these farm deserts. I'm sorry, that these food deserts that are part of our communities overall.
Yeah, absolutely. Helping bringing the healthier food to our communities and our neighborhoods who we all know, we've all seen the maps more than once probably, and they haven't changed. So how in a while. So how do we change those maps, and how do we change the look of North Texas to ensure that we have more access, and we're improving that access? And that is exactly what this conversation is focused on. SNAP plays an incredibly important role in reducing those deserts and improving that access to food. When we're talking about that access point, Jamie shared such great information on how SNAP can benefit a community. You each come at SNAP from a little bit of a different perspective. But I would love if you could take a moment. Leda, we'll start back with you, go to Tarian, and then back to Dr. Wesson. If you have a story on how you could really put a face to how SNAP is improving or changing, helping to make good changes in the community, could you share a little bit of how you might have seen that from your perspective of how SNAP has improved access in the community in which you serve?
Yeah, so just kind of touching back on what Jamie was talking about earlier through the policy, like we have seen some very good changes regarding like the vehicle asset test. We were unfortunately facing a large number of people who didn't have any changes to their household, had the same number of vehicles, but due to the vehicle values rising so much, they were essentially their resource limits were too high, and they were no longer eligible for those benefits when, one, they really needed them, and two, they had relied on them for so long. So that was a great win for us. As well as we actually, like I touched earlier, we actually have a community specialist who really focuses on re-entry. So we do help a lot of those folks that are exiting incarceration. They really need someone to help them out with that process, and just having the availability now for them to apply while they're still in the system is going to be a huge benefit. A lot of the times they may not have stable housing, they may not have just the basics mailing address, which is required to receive those updates for their SNAP benefits. So just being able to walk out and have the card in hand, they already have access to food and can utilize those benefits is a huge help. So we have definitely made some huge strides in that portion of SNAP.
Thank you, Leda. Tarian, how have you seen SNAP benefit the community that you serve?
Well, with our community, since we are based, our discussion is always based on health and wealth. After our nutritionists or dietitians have sat down to do planning with a few of our community members that receive SNAP, they were able to stretch the dollar that they're given through SNAP further, meaning since I know what to eat, it's now planned out with a nutritionist or a dietitian, I can now go into the store and be more conscious of what I purchase with what I'm receiving, which means my SNAP dollars go further because now I know how to plan my meals. Now, since I'm planning my meals, my family can have more to last longer, because something Jamie said in her presentation is that it only lasts a couple of weeks, maybe 2 to 3 weeks, normally, because it's a supplement. Well, with meal planning, you have an opportunity to use more of your SNAP dollars and make it go further because you are eating healthier. You are able to go in and purchase the foods that are going to benefit and keep your family healthy. So from my perspective, it allows them to stretch the dollar more. So their SNAP benefits go further and last longer.
Which is always beneficial for those, for so many people to help that dollar go further. Dr. Wesson?
Well, once again, Tarian has provided a great introduction to what I'm about to say. Imagine that you're in the group lifestyle balance program that Tarian described very well. And you're told these are the foods that are healthy for me overall. These are foods that are helpful for me to help manage my diabetes. These are the foods that are helpful for me to help manage my hypertension. But you go to the convenience store and the foods aren't there. However, you
Right.
go to a place like South Point Market that you have easy access to. You don't have to take a bus ride to get to the store. It's within walking distance. And so those foods that you've learned in group lifestyle balance are now available at South Point Market. And on top of that, you get 50% off the cost of those foods. What an incentive to be able to not just learn how to eat healthy, but actually to be able to implement that. And that so there are multiple stories that my wife can share better than I can of individuals who now have the direction as to what healthy eating looks like, and now the access to the foods that support healthy eating. And then Wanda can tell you about many of the great outcomes that these folks have had. Typically, when we think about the group lifestyle balance and we talk about the measure of success, one of those gross measures of success is weight loss. And of course, weight loss is a good surrogate of overall health. But more importantly, we emphasize, and I'm sure Tarian would amen this, we're really emphasizing that this healthy eating is promoting overall health, better diabetes control, better high blood pressure control, better control of your risks for those diseases, better control for risk of reducing the uh, the chances of you're getting heart attack or stroke. So all getting back to the SNAP program and particularly the incentive program where these folks can get 50% off of the cost of these very healthy foods. That is supporting health of those individuals. Those individuals share that learning with their families. And I'm sure Tarian can amen that it gets shared throughout the congregation and the community. So all of that is being emphasized and incentivized by a program like SNAP. So I go back to Jamie's very important point. SNAP is an investment in our community, and that investment is not just economic. That investment is in the health of our communities.
Absolutely. I couldn't agree more. I think, from the American Heart Association's perspective on food access, we know the importance of access to a healthy diet, to access to overall health and well-being. I just imagine an individual walking into a clinic, hasn't been feeling well. They go in to see for their appointment. They find out they're, in that appointment are diagnosed with diabetes, have high blood pressure. They've got to change their diet. Tarian, that's what your side of things is, right? Helping people to have that food element of chronic disease control. But then thinking about, well, I'm going home and I, just spent a good chunk of dollars on groceries that I purchased 2 days earlier, and now I need to change my diet. And that's just hard for anyone to do, let alone someone who's already trying to really watch their budget, and how SNAP and SNAP incentive programs can truly be a benefit because now you're incentivized for those healthier food purchases. It's helping that SNAP dollar go further and helping supplement that the income and the grocery budget that a person might have. So thank you, each of you, for kind of taking us along on that journey. I'm hoping, I saw in the chat someone ask, how do we get this message out to those who might be eligible, that might want to visit South Point Market, or want to visit a SNAP Navigator, or want to hear more about Terry and the program that you all are implementing. And one of the ways is this summit. We're hoping that this will allow more people to know about the great work that's happening in North Texas. But for those in our audience who might have a small market, Dr. Wesson, that might want to implement a type of incentive program, might want to take that next step to have more fresh produce on their shelves, maybe a congregation, Tarian, that wants to bring health lessons to their community, or Leda, maybe a community organization that's listening and saying, I want that QR code, or I need a SNAP navigator to be here. What would be the first best step? What's that next step they can take to either reach out to you, to maybe learn from someone that is doing similar work? I'll go back to Leda. What might be that first step that people can do to access some of the resources you shared about today?
So I know Elena has put my contact information, her contact information, along with Brittany Pinkert, our program trainer. So she actually does the onboarding, I'll say, for those QR codes. Anyone who is interested, we can definitely put the information in the chat again, but you guys can reach out to us directly and just say, hey, even just an email saying, hey, like, I want to figure out how we can work together. And we'll take the time to meet together and see, like, what type of agency do you have? Like, what are the needs of your specific community? Because they can all be very different. Just depending on the need, we may say, hey, like, we think a navigator would be the best fit for your specific organization because of X, Y, and Z, or hey, maybe the QR code would be the best fit for this because, because a navigator is not really needed or something like that. And because we have other programs too. We have agencies we work with that say, hey, we're having a senior day. Like, do you guys have something that you do for this? And we can have our community specialists go out and and do a presentation for that. So just reaching out to us directly and just letting us know, hey, we need this, or we want to work together in some way. We can go ahead and get those talks started, and we'll send you a one-pager too that we have of all of the different services that our social services teams provide, and that way you go into it kind of knowing and getting an overall look of everything that we do, because it is a lot.
That's awesome. Thank you, Leda, very, very much. Tarian, how might somebody learn more about the programs that you all have operating?
Okay, well, for Baylor Scott White Health and Wellness Center here at the Juanita Craft Center, you can reach out by calling, and we give you that number. It's 214, and I'll put in the chat as well, 214-865-3060. You can actually call in, talk to a person directly. They can give you information about the number of programs that we have available to you all as a community. And if you want us to come in and teach those classes, as well as give information about SNAP and other referral systems, we're there to help provide that too. Also, you can reach out to me by email. It's tarian.alexander@bswhealth.org. And I'll also provide our community outreach manager, which she helps manage a lot of the outreach programs, and that's tamara.venters@bswhealth.org. We have a number of locations and a number of communities available to help provide what it is that you need to promote health and wellness. So if you reach out to any of these numbers, we will definitely put you in contact with the different programs available. And not to forget, we also have a one-on-one health clinic available. So if you need assistance in all areas, we're there to help you figure out what we can do to help you become more healthier.
Thank you, Tarian, very, very much. And we'll make sure to have email addresses and access points sent out to all of our participants and audience members today following the summit as well. Dr. Wesson, over to you.
I'm glad you mentioned. Yeah, I put my email in the chat, so folks are free to contact me through that. I also want to emphasize that we want to maintain the privacy of our SNAP recipients, so we don't say, if you're a SNAP recipient, oh, you are a SNAP recipient, come access these benefits at South Point Market. We advertise in the community, mostly on social media. We advertise at the church, and of course, we advertise through information in the South Point Market, so that individuals can see and self-identify as being SNAP recipients. And so we want to make sure that we maintain their privacy. But once they see that availability of the opportunity to spend their SNAP benefits at the store or at any other locations that allows them to do so, then they take the personal initiative to do so.
Thank you, Dr. Weston. I appreciate it. I appreciate each of you for your time today. I want to highlight a couple of things because we are nearing our end. I know there were some fabulous questions in the chat. We, as panelists, I'm going to encourage all of us to look them over. If you have answers that we can respond to, please do so. We will follow up as well afterwards. There was a question in the chat about accessing, South Point Market. Do you have to be a member of the church, or, do you have to be a member of Baylor Scott and White's to access South Point Market? And so want to highlight that South Point Market is its own entity. So if you have anyone who wants to utilize that SNAP incentive, which Dr. Weston mentioned, gives 50% off all fresh fruits or canned vegetable produce purchases at South Point Market, that is available to anyone that is receiving a SNAP benefit. That's where the 50% off comes from. There's also other programs that are out there. I'm going to highlight two of them that are on your screen. But additionally, we are there's working with Double Up Bucks programs that can also be found at other locations. I think Wynella put them in the chat as well. So we've got a lot of SNAP incentives that are happening, and they don't do anyone any good if we don't tell people about them. So please help us get the word out. Help us get the word out about our QR codes. Our QR codes, they're not mine. The QR codes that the food bank puts out, we are utilizing those. I think a great example of that is at South Point Market. You walk in, there's a QR code right there. If you have heard about the SNAP incentive program and you want to utilize it, but you're not on SNAP right now, you can snap that QR code and start the process right then and there while you're shopping. You can help fill out the form that the food bank has. So a lot of ways to take everything we talked about today and integrate it together to make a holistic program where we are transforming our community and transforming fresh fruit produce access in our community, benefiting our entrepreneurs, benefiting our local farmers that are putting and placing these produce items into our local markets, benefiting our markets in general. Just so many opportunities to help impact that farm to fork continuum. So thank you all to our panelists, highlighting the things that you see on our screen. I want to make sure that everyone in our audience knows about two more initiatives that help expand access to healthy nutrition for families with children and older adults. Susie Marshall is a member of our leadership coalition here at the Dallas Coalition for Hunger Solutions, and Grow North Texas facilitates the WIC Farmers Market program in Dallas that benefits families enrolled in WIC. While it's not SNAP, this program provides $30 in vouchers for fresh, locally grown fruits and vegetables for each eligible person in that household. Grow North Texas sets up farm stands at WIC clinics to lower the barrier to access and improve, obviously, individuals that can take advantage of this program. Jara Fansler with the Dallas County for Older Adult Services also facilitates a senior hunger outreach project that was actually developed by the Dallas Coalition for Hunger Solutions. It's called Eating Well is a SNAP. Jara demonstrates to seniors at congregate meal centers what the SNAP minimum amount can purchase at a grocery store or at a market, and follows up with SNAP application assistance to seniors. We want to ensure that everyone from this audience today leaves with tangible examples of innovative programs supporting SNAP access right here in North Texas. Spreading the word about these programs will help ensure individuals facing hunger across North Texas know about these available resources and can utilize them to their benefit, again, really that continuum from farm to fork. I appreciate everyone's participation. I am going to hand it back over to Elena to close us out. Thank you all.
Well, Jenny, it's telling me I can't turn my camera on, but thank you guys so much for the valuable information that you shared from the panel and Jenny, and helping us to learn about community partnerships and creative initiatives that are making a difference for our neighbors in need. Now, for members of our audience, because clearly you all want to help, this is where you can play a part in changing the conversation around SNAP and expanding access in your communities. If you are wondering what you can do to support and keep this conversation going, if you're in Dallas, you can join one of our coalition action teams. You can learn about this by visiting our website at dallashunger.org to learn more about our 5 focus areas: child hunger, senior hunger, faith community engagement, urban agriculture, and public policy. On the webinar evaluation that you'll receive, you'll have an option to give us your name and contact information if you'd like to be connected to an action team. Just let us know and someone will contact you soon. If you live in communities outside of Texas or the US, you can visit frac.org to find a Road to the Farm Bill to-do list with steps you can take to help promote, sustain, and strengthen SNAP for your neighbors who need it. As we end, I want to thank and recognize the leadership team of the Dallas Coalition for Hunger Solutions. They are an amazing group of talented and community advocates who appreciate the value of bringing organizations and community leaders together to work in partnership. Thanks again to the American Heart Association, Bree Mabry, Elizabeth Tork, and Ken Toll for your technology assistance today, and our wonderful speakers presenting today. I want to give a shout out to Wynella Henderson Green, our coalition specialist who organizes our annual Hunger Summit and keeps our collective work on track all year round. And thanks to you all for attending today and for your commitment to improving access to healthy and nutritious food for our neighbors struggling with social and economic challenges. After today's webinar, you'll receive an email with a brief evaluation form. Please tell us what you learned, what you'll do, and what you'd like to know more about. Also, don't forget to let us know if you want to participate in the Dallas Coalition for Hunger Solutions. Again, this information will be sent to you, the webinar, the recording, some tools for you to go forth and help us with this work. We hope that you have a great rest of your day. Thank you again for joining us.